Okay, hello everyone, and welcome to this week's classroom session. Uh, so the course is CLC1 Supply Chain for Health. Ideally, all of you are in the third week, where we are focusing on procurement. So this session for today also focuses on strategic procurement. So, like I said in the chat, we will go about learning strategic procurement like from a theoretical perspective initially, and then there is a group discussion, a scenario and a group discussion where we will end. So I hope you have received the template of the group discussion. Priyanka, when you get a chance, also upload the template on chat so that everyone receives the template again here it says. So we will use that template to, answer the questions in the group discussion, and I will explain more when we reach there. Now, if anyone has any questions from week 2 or week 3, you can ask. Otherwise, I will begin today's session. Okay, it doesn't seem we have any question. So let's begin today's session with an announcement. We have been sending emails and WhatsApp messages on the groups about this webinar, this talk, which is specifically designed for female professionals working in the global health sector. We are launching a new community as well, linked to women in global health, where we will focus on issues linked with leadership journey, and everything that is surrounded with that issue. The objective is to help support, guide young professionals and anyone who has the aspiration to become a leader in their field. Uh, More updates about the community will be shared soon. But this is something we believe will support professionals greatly, and will create a more inclusive environment on the hive and in general for everyone to collectively excel. So don't miss this opportunity. Registrations are still going on. Priyanka, if you can paste the registration link on chat as well, so that if someone wants to register right away, if they haven't done that, they can do it right now. Now, after this, I also want to show the progress of this cohort. So this is on your screen. So I have color coded them into three colors, as you see, green, yellow, and red. So everyone whose progress is depicted in red, we encourage them to move a bit faster. They are lagging behind, and it will be difficult for them to catch up later. This also goes for people who are in the yellow. I think some of them are present today. So please, you also need to catch up. You are a bit behind from uh, the current, from the actual calendar. And as you see, all the participants who are in green, they are quite ahead. So everyone who is in green, congratulations! You're diligently following the calendar, and that makes me and every one of us really happy. That's the aim, that you can successfully complete the program. So everyone who's in green, I believe you will not face any issues in completing the program on time, which is probably in the next 2 weeks. But everyone else who are in yellow or red, please, you need to spend a bit more time on the course, uh, and then try to catch up with everyone else when we also come back and discuss next week. Okay. If there are any questions about the previous weeks or anything that I have shown for now? Please, you can ask on chat or you can also raise your hands. But let's start today's discussion again with a mood check, just like we did it the last week. So Priyanka, if you can, excellent. So Priyanka has shared the poll on the screen. Uh, let's quickly submit the polls and let's see how everyone is feeling. So I'm feeling amazing. I'm feeling great. Lots of reasons. And also it's Friday. So the weekend is coming. So hopefully lots of personal goals for everyone to achieve over the weekend. And of course, trying to finish the Friday on a high. Okay. So Priyanka, just let us know once most of them are done that we can quickly see the result. Okay, by the time we see the result, let me introduce today's session. So today we are going to understand the concept and planning that is required for strategic procurement. And I will talk more about why we've added the word strategic in front of procurement. Why can't we just say procurement, and that's it. So we'll talk about it. And then there is a case that we have prepared, which should resonate a lot with the participants who are from Zimbabwe, and I guess from Botswana as well. Although when we were designing this case, we did not have Zimbabwe in mind very specifically, but eventually the case that got designed resembles a country like Zimbabwe, so it will be very interesting for everyone. And we will discuss the questions and the issues related to procurement over there. So the results are on the screen. So 75% of us are feeling either good or amazing. That's great. There are 25% of people who are just okay. So that's okay as well. I hope after this session you will feel good, if not amazing, and you will end your Friday, like I said, on a high. Okay. So quickly, if you have any questions, you can raise your hand anytime. Although we have specific Q&A checkpoints as well, so that's a place where you can also raise your questions. If there is a very burning question while I'm speaking on a certain issue, you can write it on chat, and as soon as I'm finished with that issue, I will take up that question. If you're not speaking, please keep your microphones on mute. And then if there are any questions which we are not able to answer in this session, we will definitely send it through email or put it on the community group on Hive. Okay. So with that, let's begin with strategic procurement. So what is strategic procurement? So why not just procurement, and why strategic procurement? So first of all, strategic procurement is a much more comprehensive and a long-term process with the aim to with the aim to not just procure the products. It's a more long-term relationship building exercise, where eventually, of course, the goal is to procure the right products in the right quality, in the best possible cost, and in the lowest possible time. Okay. Of course, to satisfy the demand of your beneficiaries who can be your health facilities, clinics, pharmacies, and eventually the patient itself. Okay. Now, the reason why we are talking about strategic procurement is because if we don't uh, create a very holistic strategy around procurement, it will be very difficult to align procurement with the organizational goals, and more so because supply chain has various risks, which of course also extend to the operation of procurement. Uh, and in the long run, a well-defined procurement system, well-defined strategy of procurement, it helps increase efficiency of the supply chain as well. So that's why, we're not just talking about procurement, we're talking about strategic procurement, or having a strategy of procurement in the organization, in your supply chain or in your health system. Okay. Now, the process involves the entire organization. So The reason again we're saying strategic procurement, and one of the differentiators with just calling it procurement is that when we talk about strategic procurement, it is not just about the staff who are managing procurement or purchase of pharmaceutical products and medicines. It involves the entire organization or the system, because you need to gather a lot of inputs. You need to, you know, decide on several strategic choices, which, which a single team or a small group of people who just have procurement expertise may not be able to answer. And then, of course, together as a collective, uh, uh, with a collective approach, a long-term plan can be created, which helps everyone, be informed of the process, and then, of course, eventually leads to better management of the process. It also, utilizes information on suppliers, market trends, pricings, transactions, and other factors, other external factors. So it's when we talk about creating a procurement strategy, it is not just about the organization or the system itself, but it is also about the external factors. So those external factors must also be taken into consideration. The overall objective of any strategic procurement is to achieve value for money. That is one of the main goals. Of course, along with four other boxes which you see on screen, which says that it increases efficiency and reduces procurement time. It makes procurement streamlined rather than just an ad hoc activity. It reduces risk because risk is embedded into the strategy, and it improves quality of not just the product, but also quality of the process as well. And eventually it improves fairness and transparency, which are two key values. When we talk about procurement, they're like cornerstone of any procurement operation. Okay. Now, if you look globally, uh, almost in every country, procurement is one function which is marred with corruption, uh, biases, uh, you know, kind of colluding practices between, either between different suppliers or between the procurer or the supplier, you know, which eventually leads to very, very poor practices, like, paying much more, like paying very high prices than what the prices are globally, or doing nothing when procurement are delayed, or suppliers delay their shipments, not enforcing the contracts properly. So these are very common issues globally, and they stem from the fact that the organizations don't have something written down very clearly, which is agreed by all stakeholders, and kind of becomes some sort of a policy, or a strategy, which is also stamped by the highest authority of the government. In If we talk about public procurement, or if we talk about a private organization, then of course, uh, a document which has been collectively agreed by the overall organization, that this is how we want to purchase items, and these are the steps that we will follow. So that, if those steps are not followed, then we know the people who are managing procurement are not doing their jobs right. Okay. But if nothing is written, then it really depends on the person who's in charge. So the idea behind strategic procurement is that we want to take that power off those few people, and make it a much more wider and collective effort, to purchase the pharmaceutical products. So that is what strategic procurement is, and that's why it's very important for every organization to have a written down strategy of how, procurement must be managed. Now, some of you, mm, you know, you may see that I have asked this question in one of the discussion questions as well, where the question was, have you seen a procurement strategy in your organization? Now, a lot of you are talking about procurement operations over there, that, okay, in our organization, we develop RFQs, or this is how the bids are sent to the suppliers, we then bid, and the process is followed like this. But that's procurement operations. What we are really asking about is whether you have seen a document which clearly articulates how procurement must be done. Now, in several countries, there are overarching laws of public procurement, okay, which all public entities are supposed to follow. Uh, but since if but if each organization who is doing procurement on their own, if they don't have something written for their organization itself, there is still a lot of room for interpretation, even if there is a global public procurement policy, which is being rubber stamped by the government. So it still is quite imperative and important for every organization to work on a document which is very specific to their organization, which they want their employees or the staff to follow. Okay, so this is the basic idea of strategic procurement. Now let's move ahead and see some of the differences. I will not talk too much about the differences, but the idea is that uh, ad hoc procurement is when there is nothing defined, and then just purchasing is happening or procurement is happening on a case-to-case basis. There is no real strategy behind it. Okay, if the product is like if a product is like a vaccine, then procurement should happen like this. If it is a product which is funded by the government, then it should happen like this. Whether the product should come from outside the country or whether it should be procured locally. So if those kind of things are not written down properly, then it becomes an ad hoc approach. Um, it it in many organizations, procurement also happens like in an emergency format, because there is no clear structure or the timeline or planning about procurement. So strategic procurement also makes sure that all those things are considered and there is a clear plan of action of how procurement should be managed. Okay. A key difference between ad hoc and strategic is that uh, strategic procurement ensures that there is long-term relationship with the suppliers, which may or may not happen in ad hoc procurement, and it's very important. Okay. Now, one of the okay. Now, what we want to also talk about in this session is how to set up strategic procurement system or a procurement strategy. So the next few slides, we will talk about a stepwise method of how what kind of decisions need to be taken, what kind of analysis has to be done, so that eventually we come up to a point where we have a procurement strategy that is agreeable to everyone. Now, very simply, there are three steps. Okay. First is analysis. Second is choices, like what are some choices which are very relevant to that organization, because procurement can be done in multiple ways. So every organization must choose what is the best method or what is the best way for them. And there are several you know decisions that need to be taken in procurement, for which there are multiple options in there. Okay, so those choices also have to be made by the organization. And then once those choices are made, the organization has to plan that how to achieve those choices that has been agreed. Okay. Now, if we drill this down, this step down, this process down, then it comes to something like this. So if you see the analysis, that is quite uh, quite a bit of analysis is needed. Then the choices or choosing the options, that is one step, and then that leads to eventually the procurement strategy for that organization or the system. Okay. Now, when we talk about analysis, so what are we analyzing? We're analyzing the needs of the organization or the system. We're analyzing the core competencies, the capacity of the organization. We're analyzing what are the influences that are there for the organization, like, uh, you know, uh, like donors influence how procurement is done in many countries, for example. Communication can be looked at how communication between different stakeholders is happening. Uh, we are also analyzing the operating environment in terms of, let's say, borrowing capacity or reserves, surplus of funds. Again, presence of donors, ability to procure within the country or outside of the country. What are the import conditions, for example? What is the availability of foreign currency reserve, which is probably one of the key issues in Zimbabwe as well. That there may not be enough currency to purchase from outside of the country, which is a same issue in several African countries, like Sudan, like Ethiopia, or Nigeria. They struggle from, this issue. So analysis has to be made that, okay, what is available at what time, so that um, based on that, those procurement decisions can be taken. Then the market also has to be analyzed. When we talk about market, we talk about the suppliers, we talk about price comparison, we talk about supply positioning or preferencing in terms of whether you want to give preferences to local suppliers over the global suppliers, or how do you want to do that. So, for example, in countries where they want to set up their own local manufacturing, so they give preferential pricing treatment to the local suppliers. Okay. Then you can also look at sustainability issues, that how your procurement can become more sustainable over the period of time. You must look at risk management. The risk management is very important because there are lots of external issues. So you have to, uh, you know, preempt those risks and figure out actions that you will take in case of something happen from your list of risks that you have identified. Once you have analyzed all this, then you need to evaluate certain options. Like, are you going to do a competitive bidding, whether it is an open competitive bidding or it is a closed competitive bidding? That's like one kind of option. How are you going to review those offers? Is it a QCBS selection, whether it is an L1 selection? QCBS is quality uh, and cost-based selection. So it is not just based on the lowest price, but it also is about the quality of the product. So that is called QCBS in procurement terms. Where are you more comfortable if, where the suppliers are located? What is your comfort in that? So would you still agree if the suppliers or manufacturers are in the US or wherever in the world, or there are certain limitations? And this is very important for countries who have sanctions, by the way. So they can't have suppliers who are, for example, for several years, Sudan had sanctions from the US. So they only had limited countries who could supply them products. So they could not get supplies from the US or the Europe unless there was an emergency or very a specific approval from the bodies who had put sanctions on them. Those kind of things will also need to be looked at. And those are also strategic choices. So once all those strategic choices are looked at, then that strategy has to be written down, which can include procurement methods, bidding procedures, strategy of contracting, preferential pricing, trade terms, quality issues, budgetary issues. So all these things have to be written down, validated by various stakeholders, and adopted by the system or the organization. And that's very important because if you do that, then you almost either remove or highly reduce the scope of independent interpretation of how procurement should be done. So you take that power away from a single person or a group of people. So they are bound by the strategy or the policy which is adopted. Like either organization wide or which is applicable in the system. So again, the point here is that make sure there is a document, okay, which is adopted. Now, moving, yeah. So if you have any questions at this point as to why procurement strategy is needed, or the steps that I talked about, please you can ask questions at this point. I will take a quick 10-second break, and then I will go to the next section, which talks about certain strategic choices, certain best practices of procurement, and then we'll take it from there. Yes, Sefa, do you have a question? Yeah, Sifas, do you have a question? Okay, all right, no problem. Does anyone have any questions at this point, or shall we move to the next section? All right, so let's move ahead. So let's start with best practices in strategic procurement, and then we will look at some best practices in details, which are also part of the equation where I talked about strategic choices. So these are linked. So there are 7 points written on screen. So first being conducting market research. So research is very important about the market, because we need to know as a procurement agency, or a procurement department or a team, that who are the potential suppliers. See, there are multiple suppliers globally. There are probably thousands and millions of suppliers globally, from the US, Europe, India, China, South Africa, uh, Turkey, Bangladesh. So these are all hubs of pharmaceutical suppliers. Okay, but not everyone may be willing to supply to your country. Because of X or Y reason. I mean, there can be many reasons for that. Okay, so you need to figure out, based on your conditions, from where can you get those products. It may be a question of volume, it may be a question of price, it may be a question of geography, it may be a question of time. There may be some issues with respect to, excuse me, there may be an issue with respect to certain products, maybe because of maybe because of Brenda, can you mute? Okay, please try to mute yourself if you're not asking a question. Thank you. Yeah, so I was saying there may be an issue with a particular product because of maybe the active ingredient is not available in the market. Safest, if you keep on unmuting yourself and there is a background noise coming, then we will have no choice to remove you from the session. I'm sorry. Okay, moving on. So we also need to identify core competencies, and okay, Priyanka, you'll have to remove him from the meeting. I'm sorry. He can come back again. Yeah. So you may also need to look at some strategic partnership needs. Maybe with local importers, maybe with international procuring organizations. So there are several international procurement organizations like IDA, Mission Pharma, MEG. So these are big global importers who supply to countries and organizations alike. Okay, so you may also have to look at that. Then you may also look at establishing long-term relationships with the suppliers and the third-party reliability and quality of supply. So that's a best practice as well. And that's why initially in the strategic procurement intro, I was talking about that when we talk about strategic procurement, we talk about long-term relationships. We don't want just one-off relationship with a supplier or a manufacturer. They supply to you and then you never speak to them again. So that's not the objective of strategic procurement. Then number 4, confirming that procurement decisions are based on long-term value for money rather than just cost. Now, the difference between value for money and cost is that when we talk about value for money, we talk about the benefit of using or working with a certain supplier. We also look at time. We also look at quality. Uh, we look at several metrics and not just cost. Sometimes, if we're talking about equipment, then we look at lifetime cost. So if we are talking about large equipment, so it's not just the cost of equipment, but it also is the cost of the spare parts, the reagents, the supplies that are needed to run that equipment. It is also about the cost of electricity, cost of labor, maintenance, insurance, so on and so forth. Because it's that equipment has a life of 10 years, so you will have to bear some cost for 10 years. So you'll have to prepare a full lifetime costing for that equipment to know, which supplier is giving you the best value, for the entire period of 10 years, for example. Then one of the other best practices is to monitor supplier performance. Okay. Uh, and monitoring supplier performance is not always about like a fault finding mission. It is not to find ways of not paying the suppliers, for example, which is generally a lot of organizations do this for. But this is mostly to build more concrete relationships with your suppliers. It is to understand what is working well and to understand the deficiencies and how those deficiencies can be managed. Okay. So it's more about implementing corrective actions rather than reprimanding the suppliers. Okay. Number six is leveraging technology. See, we are in a world where everything is now connected to technology. So procurement must also be connected to technology if possible. Okay. Uh, we'll talk about e-procurement in the next few slides as a slightly uh, zooming into one of these best practices. Okay. And then finally, number seven is collaborating with other stakeholders such as donors, partners, uh, suppliers. You can also collaborate with certain suppliers. You can collaborate with foundations, where you're not just looking for money, but you're also looking for expertise. You're looking for guidance. You're also trying to create your network. So when we talk about strategic procurement, we also talk about creating a network. So in a network, you can have multiple stakeholders. You can have your suppliers. You can have your big, procurement agencies, you can have your donors, you can have implementing partners, you can also have for a government organization, you can also have institutions like WHO, UNICEF, UNFPA because they are your partners. Okay, when you're talking about working in a public sector. So these are some best practices in strategic procurement. Now we'll look into some of them in a bit more details and starting with okay no so there is a sorry there is a case study as well, but again this case study is looking at best practice number six. So uh, again like I said uh, we're zooming into some of the best practices and technology is one of them. Now the reason why we're talking more about technology is because in today's world procurement like everything else is happening digitally. So if you're still doing it manually, then your efficiency is quite low. Because you can do much more when you are managing things digitally. So that's why we want to give you a case of Rwanda and also talk a bit more about e-procurement. So before 2012, Rwanda also had a manual procurement system, proper documentation, signatures from everyone involved. We call it paper pushing, for example. But in 2012, the government launched this project to digitize the entire public procurement process. Now, but this is not just health, by the way. This is for every public procurement system, every public procurement organization in Rwanda. Okay. Now, since this is a very large undertaking, indeed, they faced a lot of challenges, not just related to technology, but also because people are reluctant to change. So they had a lot of resistance from old stakeholders who were not very comfortable with the digital system. Um, Internet was still an issue in Rwanda in 2012, so they also faced that issue. But today, it's not really an issue in Rwanda. They have very good connectivity over there. They had limited capacity of experts who knew how to work these kind of systems out. Okay, and more importantly, the security and confidentiality of the entire process, which means confidentiality of the data which is being provided by different suppliers, making sure that data from one place is not visible to the other suppliers, because that would disqualify the entire process. Despite all these challenges, they were able to manage this project, and it was a resounding success, mostly because they had a strong political will, and that we will see in Rwanda in many areas, that they have a very strong political will. If they say that, okay, we want to do something, then they will get it done. Okay, and that kind of will is needed in public sector to get anything done. And okay, not just public sector, but anywhere in the private sector as well. They also had a very strong partnership with the private sector to provide the technology, technical support, training, and everything. Education and awareness campaigns were launched so that everyone can be brought into the fold. And then they had a very comprehensive monitoring and evaluation system to keep on checking the system and improving it at the same time. Okay. So today, if we go to Rwanda, you will find all public procurement is happening digitally. So they are one of the pioneers, probably one of the pioneers in Africa when it comes to public procurement, and probably for many other low and middle income countries across the world. This is a case about e-procurement. Now, let us see what is e-procurement if you are not very sure. Now, what e-procurement does is that all the steps that you follow in a procurement, in documentation, all that documentation happens within one electronic system. So it's like your LMIS system, ELMIS system that you use in supply chain, very similar to that. But in this case, you are talking about submitting bids, getting offers, creating contracts, making sure those contracts are addressed and fulfilled, and then paying. Payment also happens in the same system. So all the data, all the records of your suppliers, of your products, pricing, payment system, invoicing, documentation, everything is done through that system. So suppliers also get an interface of that procurement system. So they upload documents from their end. The organization looks at those documents from their end. So there is no need for printing down the paper or sending the paper by fax or direct mail. Everything can happen within that system interface. Okay. These are some benefits. It increases competition because digitally, your advertisements also can go much further. It reduces a lot of operational costs, like simply printing and procuring paper itself. So that's a massive cost, just so you know. It improves data accuracy. It improves transparency because unlike in paper-based procurement, if something is approved in the system, uh, no one can go and change that because there are different validations needed. So if someone wants to change it, they will have to take approval from the higher authority, and then it will be shown everywhere. So it won't be something that can be privately done, unlike in a paper-based situation. Okay, so that's why it is being increasingly used now everywhere in both public and private systems alike. And if you're not aware of it so far, I would urge you to look more into it, read more about it. There are multiple e-procurement systems everywhere, systems recommended by the World Bank, to local systems, to, I don't know, there are so many in the private sector as well. Okay. Now, the second, now we just finished e-procurement. I mean, in this session, we can only manage this much because we only have about 2 hours. So I have about 15 minutes to cover two other strategic choices, which also is part of best practices in one way. But a choice when we talk about procuring large medical equipment. Sorry, you have to give me 1 second. I'm so Yeah, I'm so sorry. I'm back. Yeah. So when we talk about purchasing large medical equipment like the like MRI machines, CT scan, radiology equipment, they are very capital intensive equipment. Okay. So there has to be a discussion whether you really want to purchase a big equipment, or you can also procure them as a service, which we call leasing, for example. Now, this is something which is gaining a lot of popularity over the past few years, where an organization can lease a big equipment directly from the manufacturer without paying the upfront, capital. Okay. So it's like a per month or a per quarter cost, okay, that is being paid to the manufacturer. And then the manufacturer is also giving you the reagents, the supplies. In some cases, they can also give you a staff to manage that equipment. And if you have done your contracts in the best possible way, then the manufacturer can also replace that equipment if they come up with a new edition or a new version of that equipment. Sometimes it happens that a CT scan machine gets upgraded. So then you get the upgraded version as well. Okay. So this is something that procurement team or procurement department must look at, that do you always need to purchase? Okay. In some cases, purchasing is good. Okay, you will have complete autonomy with that piece of equipment, but then you should have that much amount of money in the organization to buy those heavy equipment. Okay, so there are pros and cons on both sides, so we can quickly look at them. So as you see, the benefits of leasing: access to latest equipment, uh, conservation of cash flow and capital, reduced maintenance cost, flexibility in contracting. You have the latest technology possible with you, and the manufacturer is also helping you in overall asset management, because once a big equipment comes to its end of life, there is huge cost involved in its disposal. And I have personally seen big equipment still being kept in one corner of a health facility or a hospital, because they just don't have the funds to dispose. Okay, or they are just being put on a vehicle and just thrown somewhere, in a landfill, or just some corner, because they just don't know how to dispose of it. Okay, so with this, the manufacturer also helps in disposal of that equipment, which means they will tear it apart, and whatever the useful parts that they can find, they will reuse it, and everything else then is properly recycled, or goes into proper disposal procedure. However, there are some challenges or risks that's also there with leasing and procuring as a service, uh, which may be like compatibility between the equipment which is being leased and other existing systems. So you have to make sure that whatever you are leasing, they are compatible with existing systems. Regulatory compliance, which is very important. Whatever that you are leasing, it has to be also approved by a regulator. Maintenance repairs can be an issue if you do not find a way to add that into your contracts. Um, Financial considerations must be looked at in terms of negotiations, in terms of payment schedule, in terms of lease duration. So all those things might pose a challenge, but that can still work out if your procurement team is smart enough to manage these things. However, a key risk is data security and privacy, because if the manufacturer has control over how that equipment is being operated, even remotely, they can access a lot of data which is generated from that piece of equipment. So you have to make sure that the contract that you sign with the manufacturer, it has very strict laws on what kind of data can they access and what data they will not access, or even if they can, they will not take advantage of that data. Okay. So all these issues can be managed through negotiation and having a very comprehensive uh, contracting technique. But still, these are certain challenges of leasing. Something that a lot of people talk about when asked about leasing is loss of control. Sometimes people feel that they don't have control over how that equipment is being managed, and that is mostly because the contracts were not written properly. Okay. So a key thing here is that contracts have to be written properly. Now, I was taking this class with the group in Nigeria, and we had a participant from a big tertiary level hospital in Lagos. So she came up with an example where they had gone into a public-private partnership where the private company from Belgium or something, they gave them five or six different big equipment, under these kind of conditions. However, one thing that she mentioned was that the contracts took 6 months to negotiate. So that means they were quite thorough with the contracts, and they were not being pushed by that manufacturer, because it's a win-win for both organizations, both for the manufacturer and both for the hospital in question. So the important thing here is to make sure that the contracts that are written, they are written in a way that is favorable for both parties. Okay. Now the second strategic issue that you can look at is pooled procurement. Now, uh, this is something you may already know about, that if different organizations or different states or different countries come together, and do the procurement together, we call it pooled procurement. Can anyone tell me one of the biggest pool procurement initiatives globally in health and pharmaceutical? Those names are quite common, but a lot of people don't understand that those are pool procurement initiatives. So can anyone, either you can write in chat or you can also talk. The few biggest pool procurement initiatives globally in the health sector. And I'm very sure the products in question, all of you are using, and you know about those organizations, and you talk about them almost every other week. So anyone? No? Okay. Uh, so one of the biggest pool procurement initiatives globally, one is Gavi. So Gavi, which supplies funds for vaccine. So that is a pool procurement initiative which happens globally. The second is the Global Fund, where they fund for HIV, TB, and malaria medicines. That's also a pool procurement technique. PEPFAR is also a pool procurement technique. So all these big donor-based systems, programming, they're mostly pooled procurement techniques, and that's how they're able to get better prices, smaller lead times, and that's why I've also been reading in your submission that even in Zimbabwe, the programs which are managed by the donors, they have less issues. They see less frequent stockouts. They see, better inventory management and so on and so forth. And one of the primary reasons for that is that globally, those products are procured in a way that it helps any country team to, manage it, because the procurement is happening globally. If you talk about Global Fund, if anyone from this group has worked with Global Fund, then they use a system called VAMBO, and it's a global pool procurement system. So you just need to go on VAMBO and put up your requirements, and then everything will be done by the VAMBO team, which is part of Global Fund. Similarly, if we talk about Gavi, then they work through UNICEF or some other partners as well. All that is done globally. So all negotiations are done globally. All the requirements are looked at and organized globally. So all of this is happening globally, and hence at a country level, you're getting the best prices or products on time or without any issue. Wilson is writing, pool procurement is a big opportunity which is currently being missed. The SADC has a pool procurement guidance with Zimbabwe, Botswana, and other countries that can leverage. Exactly. So even in Africa, if we look at the East African bloc, they have a pool procurement system. There are certain countries in the West African bloc, not the entire West African bloc, it's very big, but there are a few countries who have maybe 4 or 5 countries. Ghana is one of them, Senegal is one of them. So they have a pool procurement system within those few countries as well. There are some group of NGOs in the eastern and southern African countries who have put together their procurements together, and they also create a pool procurement system. So there are multiple examples that it is manageable, it is doable. It's just that when it comes at a country level, there's a lot more negotiations that are needed, and still the expertise may be missing a bit at a country level. So it's probably more an issue of expertise and having a more comprehensive dialogue and negotiation. But as a science, as a technique, this is a really good way of achieving better prices, lower lead times, better supply relationships, all those things that we talked about. Okay. Um, there are several advantages of pool procurement, like cost saving, increased bargaining power, efficient use of resources, because of course multiple organizations are coming together in purchasing the same products. Okay, the quality will definitely get improved when the supplier knows that uh, the supplier is supplying to multiple countries. So if the supplier screws up in quality, they know that they will be banned from all these countries at once. Risks are reduced because they are shared or divided amongst these several countries or stakeholders, and of course it promotes collaboration amongst those entities as well. So there are these multiple benefits of pool procurement, but are there any challenges? Have you come across pool procurement? Do you know of any challenges in pool procurement? So this is something that we can quickly discuss, if you want. Otherwise, I think the next thing is the yeah the next thing is the assignment. So I can pause here for questions. If you have questions on e-procurement, on leasing, on pool procurement, please by all means ask. You can also respond to this question on screen. What are some challenges of pool procurement? Uh, if not, then we will go straight to the group discussion. Okay. No questions, no comments. Okay. Now, the objective of this group discussion is to uh, give you a more practical idea of procurement strategy, what all procurement strategy includes from a practical point of view. Now, a prerequisite to this is that everyone has to contribute. I mean, you cannot stay silent. Now, I'm also thinking, instead of creating two groups, because there are only about 10 participants right now who are present here, we can also do this in plenary. So I can also share my screen, but still, the prerequisite is that all of you who are present have to discuss. You have to work as a small team, uh, provide inputs. So generally, the way we do this is that we create two groups. We create two captains who share their screen with the template which was shared earlier. And then with the discussion, they write all the answers based on the discussion. And then that file is shared amongst everyone. Okay, that is how we generally do it. But I see here that one, there are less number of people and a bit reluctant to speak as well. So what I'm suggesting is that we can do this in plenary. I can share my screen, but still, if you don't speak, then there will be a problem. So you have to take a collective decision here. Do you want to go into groups or do you want to do this in plenary? Uh, I'm happy to do it in both ways. So please decide very quickly. In the meantime, I can read what Margaret is saying. The challenge is that is there a chance of getting products that you may not like simply because products have been purchased? Margaret, that's not really a challenge. This is not how pool procurement works. Uh, when we talk about pool procurement, first of all the parties who are entities who are working together, they agree on the list of products. Um, because if you, I mean, the entity together, you are not procuring things that you don't need. Okay. So those products have to be agreed in advance with all the entities, and only then they will be purchased. Okay. So that's not a challenge, but the challenge can be that if in a group there is an entity who has a bit more power, because purchasing power or any kind of power, let's say, depending on the size of that entity, if there are countries, if there is a bigger country and there are smaller countries, then the bigger country will always have more say of what they want or how they want to go about it. That can be a challenge. Okay. However, generally, any pool procurement system, products are agreed in advance and then they are purchased. Okay. So I see by the time I was talking about this discussion, someone has dropped off, and I don't know whether that is Wilson. If it is Wilson, that is still okay. I also see there is one participant who doesn't have the microphone, which means they can't speak. So we have one, two, three, okay, about 10 people. So I still feel we could do this in plenary. Again, I haven't heard much from you, so I would rather go with my own intuition and then do this in plenary, and then request everyone to speak up. So let me first introduce the case, although you may have read it uh, on the slide which was shared. So there is a fictional country called Fictivia, very original name, and you can see it has 5 regions. Okay, um, it is a landlocked country. Okay, so there is no seaport. Now the country has a very limited local pharmaceutical production, so it imports almost everything that it requires in terms of pharmaceutical products. Uh, Freight forwarders are used from the neighboring country which has a seaport. Okay. Uh, it usually takes 6 months for the products to reach from the supplier to the seaport, which is in the neighboring country. And then from that neighboring country, it takes 3 months via road for the products to come to Fictivia. So in total, whenever Fictivia places an order, it takes 9 months for the products to reach. Okay. Now, Fictivia is it works on a decentralized agreement. Okay. So every region, they have a regional health directorate and they have a regional logistics unit. So every region manages their own health system and their own health supply chain. which means the Regional Logistic Unit, RLU, the acronym of Regional Logistic Unit, they purchase, warehouse, and transport medical products to the various hospitals and health centers in their own region. So they have 5 regions, and each region is managing their own supply chain. Okay. There is no central actor when it comes to supply chain in the country. The only consolidation happens when each of the region they report the annual consumption data to the Ministry of Health for broader surveillance and analysis of the country's health system. So that is the only place where consolidation happens. Otherwise, all the regions they work separately. Products are funded by the national and the regional governments with participation of international donors as well. Okay, so the federal government and the regional government both put in money to purchase products. Now, very recently, there was an audit of the regions by the financial controller, which is a federal body in the country, and they found several problems in the procurement process in all these 5 regions. Number one, there was a large difference in procurement prices for the same products. So, if paracetamol is being brought by all the 5 regions, they are paying different unit price everywhere. Okay, there is no consistency. The length of the procurement cycle is also different. Okay, difference between ordering and receiving. So some regions they receive their products within 6 months of beginning the procurement cycle, while for some regions, um, sorry, it should be 9 to 18 months, not 6 to 18 months. So some regions they receive it in about 9 months, which is the standard period, while the other regions it may take up to 18 months, the double time. Okay. Frequency of orders is also variable. So each region they place their orders in a different cycle. So one of the regions may place once a quarter, while someone may place the orders every 2 years. Okay. Overall, there are many reports of stockouts. So stockouts are quite prevalent and everywhere. So no region is spared of stockout issue. Also, the regional logistics unit, they do not impose any penalties on suppliers for late delivery or poor quality of products. Okay. Now, based on these findings by the financial controller, the Ministry of Health, which is the federal body, they have decided to intervene and ask all the 5 RLUs to collaborate and find solutions. So they went into negotiation and they decided that although every region needs a regional logistic unit, but there has to be a central logistics unit who manages procurement, strategic procurement for the country in coordination with each of the 5 regional logistics units. This is the case. Now, what is needed when we go into discussion is that the committee, although agreed that a central logistics unit is needed, but they could not agree on how that strategic procurement will be designed and conducted. So this is what we are supposed to discuss and figure out. There are these 8 questions to support your articulation of the strategy of procurement in Fictivia. And we will go over these questions one by one when I show you the template on which we will work. Okay. So Priyanka, maybe you can stop sharing your screen and I will do it from my side so that I can show the template and also make sure multiple. Yeah, it's great. It's a lot. Now, in the meantime, I hope you have the PowerPoints. Please go over that, and if you have any questions, please ask them to me. Okay. Okay. So I'm sharing my screen now. So this is the template. So the case is again written here. Okay, so if you also have the template, so you can read the case here. Now, the first question that we need to answer is what should be the relationship between the central logistics unit and the five regional logistics units. So when we talk about relationship, we mean legally how they should be associated, and who should have the who should manage the functions related to quantification, procurement, warehousing, transport, transporting of those products, reporting, and payment. So this is a big question. So once we answer this big question, then we go on to some smaller questions on whether CLU should purchase separately or together, frequency of purchasing, having a central warehouse or not, how will order quantities be determined, who will pay the suppliers, what procurement method should be used, and what are the services the freight forwarder should be asked to provide, discuss where should the products be delivered and the Incoterms. Okay, but we start with the broader question about the working relationship between the central logistics unit and the regional logistics unit. Now, at this stage, you have to speak because I cannot answer this. This is all about you to discuss. Someone can take lead, and then others can follow. But this is where the discussion has to begin. Okay, there is no other choice. So over to you, everyone in the class. Yes, please. You don't need to raise your hand. You can just unmute and start speaking.
Good afternoon, colleagues. My name is Wilson Mzondiwa. I think in terms of sharing the responsibilities between CLU and the five other LUs, I think the Central Logistics Unit should be responsible for the actual procurement and also the payment. In my opinion, the RLUs should do their quantification separately but consolidated at the CLU. Then the warehousing, I also propose that the CLU should have a central warehouse, and the RLUs should have their own regional warehouses. Then in terms of transportation or distribution, I think if we propose a pool system, then the regional logistics units should have their own trucks, which they use to collect the commodities from the central warehouse. And the reporting, I think, should be both ways, both at central and the five regional logistics units. I think that's what I propose for now. And we can hear from the other colleagues. Thank you.
Excellent. Very good response. I'm sorry, I don't know how to pronounce your name. I will just call you Muz. Sorry, it's a tongue twister for me. So, but great.
The surname is Mzondiwa, but you can
Okay.
use for my first name.
I'm sorry, I don't know. I mean, even on Zoom it says Muzondiva. Okay, maybe Muzondiva. I'm calling it right, maybe.
Yes, it's still fine that way. It's okay.
Okay, thank you so much. Great response. Does anyone have any counter arguments to what he has said? However, he did not respond to the primary question, which is what should be the relationship between the CLU and the 5 regional units. Okay, so please should someone should take up that question, and anyone is they can, anyone can provide some counterpoints to what he has said. Also, Priyanka, if you can lower the hand which was raised. Thank you. Okay, no counter arguments. Okay, anyone? It was a good start, but let's carry on in the same spirit. So, Muzondiva, you have raised your hand again. So, is there something else you want to contribute to this question?
Yeah, I want to come back on the relationship if no one else is willing to take on that one.
Yeah, sure. Please go on.
Yeah, I was thinking the Central Logistics Unit should have a supervisory role to the regional logistics units so that they've got authority to decide or to consolidate or to get the regional logistics units to comply with the procurement rules and regulations, as well as the distribution and the reporting requirements, which any other responsibilities that the regional logistics units will be assigned, the CLU should have authority to get the regions to comply with the regulations. Yeah.
Okay, excellent. That's a great response. Tinashe, if you want to add to this or provide a counter agreement argument.
Thank you so much. Good afternoon, everyone. My name is Tinashe Fusire. I just want to add a little concerning the relationship between the Central Logistics Unit and the regional logistics units. I think the two, in terms of quantification, the CLU and the RLUs, they should work together closely so as to gather information on consumption data, the forecast needs, and also to conduct quantification exercises. So it's the RLU that should provide specific data on their regions. Then the CLU can now consolidate and analyze the information to come up with procurement decisions. And also, I think every step along the way, the CLU should be working together with the RLUs so that they come up with good control measures. Thank you.
Okay, excellent. I'm just reading some points from the chat. While at the meantime, if someone else wants to add something to this, please do that. Okay. Lou is saying CLU should set standards. Okay, so now this is a slight contradiction here. So either they can have a supervisory role, like Muzondiva said, or like Tinashe and Lou are saying, they should have a more authoritative and like a role where they're setting standards. So there are these two options. Okay, so CLU should set standards. RLU should be collecting data. That's okay. Okay, CLU should do most of the coordination, procurement. Okay, so let's add this here. most of the coordination, procurement, management, technology, processes and monitoring and evaluation. Auxilia is saying CLU should be head of office responsible for all procurement processes, just like NAT Farm in Zimbabwe. Okay. Which is very similar to what I've just written. Then Lou is saying CLU should do, okay, this is already I've written. Again, Auxilia is saying RLU should provide primary data collection. That is data collection. CLU should consolidate the data. Okay. So, which we have written already here. Okay. So, I've covered everything that has been said so far. So, are there any counter arguments to what has been written on the screen? So, if there are any counter arguments, please say them or write them in the chat. Otherwise, then I will move to the next question, because it seems this one is more or less completed. So now, if you see here, when we were discussing strategic procurement initially, I said that there has to be some strategic choices. Okay. Now, in this case, uh, there is nothing wrong if CLU has a supervisory role, or if CLU has a more authoritative role where they're setting standards, checking compliance, and doing a much more close coordination with the RLU. Both sides have their own pros and cons. Okay. Similarly, someone said RLU should collect, while someone else said CLU should provide transportation for the products to go from the central warehouse to the regional warehouse. And then probably what almost everyone has missed is that from RLU as well, the products have to go to the health facility. So there has to be some transportation to be managed probably by the RLU, because now it is happening in their regions. Okay, so again, that's a strategic choice. Whether you want RLU to collect or you want CLU to dispatch and you get the product directly to the RLU. So that's another strategic choice. Now, I think everyone agreed when this is being said that CLU should be responsible for procurement and payment to suppliers. I think this is where everyone agrees, so I don't see any counter argument to this. Someone said RLU should manage quantification, but then send the data to the CLU who will consolidate, while someone else said CLU should do the quantification, RLU should just provide data. So that's another strategic choice. Okay. This is here. So that's another strategic choice. So now, if you're seeing what's happening here, see, there is nothing wrong with both the statements. Both can be done. This is more about having the right choice based on that particular context. Okay. And that is what strategic procurement means, that there are multiple choices and every choice is correct. There is no wrong choice here. But what is important is to know what is the best choice based on your current system. And also, if there is a negotiation happening like this, where the regional entities are negotiating with a central entity, then there has to be some compromise as well at some point, which works for everyone. Okay, so that's a strategic choice that has to take place and has to be written down properly. So that's why we are writing down all these things, so that you all see how a procurement strategy is drafted. So this is I can say a very basic, a very simple example of how a procurement strategy is drafted. In reality, it is a much more, it's a much longer process. It requires a lot of research and a lot more stakeholder coordination. Okay. Now, moving to the next question, if I see there is no other response to this one. So the next question is, should the CLU purchase products for each region separately or together? How will this work? Okay. So anyone can unmute themselves and start to speak, or you can also write in the chat. Both options are acceptable to me, and I will start writing as and when options are presented. So back to you, everyone. Now, this is something we discussed briefly in the theoretical part. So now there is a practical question. So should the CLU purchase products for each region separately or collectively? And how will this actually work in a practical sense? So who will take a crack first? Yes, Mona.
My suggestion is that the CLU should purchase the products for each region together, so that they benefit from the economies of scale. It means it's more like pooled procurement. It will make it cheaper. That's my suggestion.
And any idea on the second question? How will this work?
I think it will depend on whether their funding sources are at regional level. If they are at regional level, it will mean they have to be centralized with the CLU, so that practically
So
either
if we sorry, just a second. So if we go back to the case, if you see here, the case says that every region has the purchase power, while the Central Ministry of Health also has some level of purchase power, and there are some donors as well. So purchasing, because overall the system is decentralized. Okay, and that's why this question is being asked that how will this work? Because under a decentralization agreement, each region has the power to purchase. So which means they also have funds to purchase. Okay, so now I think now you can form your answer, I think, in a much better way.
So in this case, it means they should have some kind of a working group which encompasses all the funding the authorities, and then they agree on the process to undertake, whether there is an existing long-term agreement or they issue out an ITB. I think that's my suggestion for now. I leave it to others to add more.
Okay. Please, anyone who wants to say, you can start speaking. In the meantime, I will read some points in the chat. Everyone is saying they should do a bulk procurement. That's okay. Lou is saying CLE should compile orders from different regions and procure for the whole country. They should also ensure there is buffer stock. Yes, that's correct. CLU should also ensure having buffer stock at the central national warehouse. Then Angelia is saying can purchase product for each region. Yeah, okay. Same price, commonly used products. CLU can facilitate the purchase of regions. Yeah, okay. Tinashe has a very good point that there can be some products which are very specific to the regions. Now, who should purchase those products? Should the CLU purchase it for the region, or should the region purchase it themselves? Now, keep in mind, the country does not have any local manufacturing. So whichever way, the products has to come from outside the country. Now, the question being, if even if there are some specific requirements of some regions, could they be managed by the CLU, or should the region manage procurement for those very specific products which they need? So, Tinashe, a question back to you. Maybe you want to speak as well. Okay, Anesu is saying purchase products using pool data. Also increase the purchasing bargaining power. RLUs can forecast the need and have them met separately, but through the CLU. Yes. This is a good point. this is a good point here. Let me write this down. So for region-specific products, RLUs can forecast the need and have them met separately, but through the season. Okay. I'm still waiting for the response of the question which says how will this work? So how exactly from a practical perspective, like Muzondeva mentioned that there may be a need to create a working group or a structure where funds which are available should also be pooled, because when we talk about procurement, eventually we have to talk about funds. So there has to be a mechanism where CLU can access the funds which are earmarked for the regions, and some funds are also with the national at the national level, and also there are certain funds with the donor. So maybe one more answer of how will it work, and then we move to the next question. Anyone? Okay, maybe someone is typing. So let me, in the meantime, so if any response comes on this question, I will come back. But in the meantime, let's go to issue number 3, which is how frequent should the purchasing and supply cycle be? So let me make it a bit more clearer here. When we say purchasing cycle, okay, all right, let me come to Mavis' comment later. But when we talk about purchasing cycle, it means when the tenders are being floated. And when we talk about supply cycle, which means when the orders are being given to the supplier. So two different issues here. Now, as you know, it takes 9 months for a product to arrive in the country. Okay. So based on that fact, decide how frequent should they be issuing tenders, which takes its own time to identify the suppliers and then so on and so forth. And how frequent should they be issuing orders to the suppliers? So that's the key question. And then I think on the previous question, Mavis is saying ad hoc procurement should be allowed at regional level in case there are any emergencies. Now, as a from a theoretical perspective, Mavis, you are absolutely right. But keep in mind that the country does not have any local manufacturing. So where will the regional units purchase these products? Now, if they have to do international procurement, so if they are doing international procurement, then why set up a CLU? That's the question back to you. And anyone who wants to take a crack at this question, the frequency of purchasing, which is issuing tenders, and frequency of issuing orders. Okay. So let me wait. Any response on this? So some options here can be okay. So for some reason, Lou's messages are coming only to me. But what Lou is saying is this. Supply cycle should be shorter than the 9 months. So she's saying perhaps 3 to 4, which is like a quarter. There's plenty of opportunity to rebuild supplies and minimize the chance of stockouts. So if I understand this correct, Lou, you're saying supply cycle, which means orders should be placed something like quarterly. So this is what I get from your response. Anyone has Any other argument on this, that how frequent the orders should be placed? Is quarterly a good frequency, or it should be you know maybe longer, maybe every half year, or should it be monthly? I mean, but what's the justification? But before the order should be placed, the key question is, um, how frequent should they be floating a tender? How frequent the CLU now, because you have agreed that it should be CLU. So how frequent should the CLU be floating a tender? Yeah. Any answers? Yes, Muzamil.
My suggestion would be that if the funds permit, we can float one tender per year, but then we place an order and agree with the manufacturer not to ship the supplies at once. That's when probably we can divide the deliveries into.
So that is what the orders are meant for, Muzamil. So suppliers will only ship when you put up a request for order. Okay.
Yes.
So that is what the
But,
question is.
yeah. So which means the deliveries, I mean, the ITB should be one per year. Then and they have 4 orders per year, which means quarterly. Why? So that we manage the expiries of different medicines. If we deliver it once, then probably the expiries, which might be different, will also be affected. Remember, they have lost about 9 months of shelf life
Exactly.
along there. I think those are the factors we should put into
Yeah.
consideration.
So that is one option where Mozambique is saying the tendering must happen per year, once every year. When based on that, you are sending your order requests every quarter to make sure that there is still some time left before the products expire for them to get distributed and used. Another argument has been presented by NSU. He's saying tenders can be floated every year to supply for the next 3 years. Okay. Now, this means it's a framework contract, Anisu, if I'm not wrong, what that you are suggesting, to have a framework contract with suppliers for 3 years, and then orders are being requested every 6 months. So let me put this into a bit more of perspective. So let's say yes, a framework contract. So let's say they establish the CLU and the CLU does their first tendering. So whenever they do their first tendering, now the tendering itself will take some time. Let's say it may take 6 months. Uh, Once the tendering is done, let's say they issue their first orders, which will take 9 months to come. So the first orders that will be received by the CLU will come after 15 months. Okay. So we have to make sure that orders are requested in a way where after the first order which has come, after like in the period of 15 months, after that the frequency is slightly lower. So then we have to decide very carefully whether orders should be placed at a 6 months interval or a 3 months interval. Okay, again, that this is a strategic choice, but in this case, it has to be well informed based on the inventory cycles of the country. Okay, we already know it takes 9 months to come. So there is no negotiation, like no other discussion that can happen over there, because that's an external issue. You cannot do anything about it. Okay, you may ask, the suppliers to be slightly quicker, but still, maybe from 9 you can reduce it down to 8 probably. But it won't get reduced to 3 months because it takes 3 months itself from the seaport to your central warehouse. Okay. So again, this is a strategic choice. Both options can probably be correct depending on how you look at it. But if you ask me my recommendation, I would say tendering should be done uh, in a way which is not happening every year, because tendering itself takes time. So tendering every 2 years or every 3 years makes more sense with framework contracts. And then orders can be initially, when you are setting up the systems, can be more frequent, but in the long run, maybe you can place orders 2 times in a year. Okay. Now again, this we are thinking from a perspective that the CLU will be able to place orders of every product at the same time, which in reality is not possible. So in reality, they may be putting up orders every other month for different category of products. Okay. So we have to really make sure that for a category of products, what is the frequency of each order. Okay. So that again makes it more complicated. Okay. But I think at this point, this is okay. And then we can move to the next question. The next question is, should there be a central warehouse? And how many months of stock should it hold? I think this was already answered initially, that there should be a central warehouse at CLU. So that I can like. But if someone has a counter argument to this, please, by all means, you can say. But the other question is how many months of stock it should hold. That is quite important. Yeah. So please, anyone who wants to speak, write on the chat. Please go ahead. Anyone? It's a bit of a difficult calculation here because uh, at minimum, the CLU should have, I mean, now, okay, Lou has a response. Lou says the central warehouse should at least hold 6 months of stock. Now, Lou, I know you can't speak, but you have to provide a justification of why you say 6 months. And I will also ask a follow-up question to everyone who thinks there should be a central warehouse. And that question being, uh, currently in the country, there are 5 regional warehouses, and there is no central warehouse currently in the current situation. If a CLU is being established, and then we say that there has to be a central warehouse as well, and someone else is now saying with at least 9 months of stock, someone saying 7 months of stock. Although, please also give some justification as well. Now, that warehouse will be a big warehouse, okay? And warehouses take a long time to construct. So that means more delays. So how can you still establish a CLU without delaying the process? Because currently there is no warehouse. So if you want to create a new warehouse, it will take a lot of time. Okay. So what are some options where uh, you can still have a central warehouse, or may not have a central warehouse, but still function exactly the way that you have proposed initially? Any ideas? And on the chat, people who are writing the amount months of stock that should be held, please also write a bit of justification on why you think so. Because it is important for everyone to know why you think if 7 or 6 or 9 months of stock is needed. I mean, 9 months is a simple one because it takes 9 months for the products to arrive. But 6 and 7, maybe a bit more justification.
I think the central warehouse should do hold 4 months of stock where we have quarterly orders per year. So, so that because it means the deliveries between the separate orders will be will differ in 4 months, which means every quarter we have a delivery. Of course, the initial order we have no choice, we have no control over it. But once the initial order is arrived, it means every 4 months we are going to get the next order. So, in my opinion, the holding a 4 month stock would be ideal.
Okay, that's a very good justification. Anyone who wants to challenge and give another justification? Yeah, I'm not seeing much justification coming, just like Muzondiva has mentioned. We're just saying it should have 6 months, at least 6 months. Okay, and NSO is saying CLU to have 3 months and RLUs may hold 6 months. So if there are no central warehouse, then orders should equal 9 months stock and stored at regional warehouse. Yes, that's correct, NSO. The other options in this case, without constructing a large central warehouse, is to again lease one. If you remember, we talked about leasing, and leasing also works with warehouses. So the CLU can identify some warehouses which are up for lease, so they don't have to spend on construction. They may also outsource the warehouse. There may be a perfectly running warehouse, where private sector organizations, they just, let organizations use that warehouse for whatever that the organization wants. So that's one option. The other option is that the central warehouse, it can be so there are 5 regional warehouses. One of the 5 regional warehouses can be nominated as a central warehouse, which is probably closest to the road network from where the supplies come from the seaport. So that is another option, that one of the regional warehouses become the central warehouse as well. Okay. So that's another option. So these are certain options. Now, when we talk about months of stock being held at a warehouse, there are certain things to look at. One, which Muzondiva mentioned, that if the orders are being placed every quarter, then the warehouse should have a minimum of 3 months of stock. However, something that we discussed earlier, it was written that there has to be some sort of a buffer stock as well. Okay. It also depends on the capacity of the warehouse as well. That's true. Okay. So we don't have that data, so we can't talk about the capacity, but we can talk from a perspective of the order cycle. We can talk from the perspective of how much does it take for the orders to come, which is 9 months. The order cycle is quarterly, which is every 3 months. So another option that can be is something in the middle, 6 months of stock, so that we add 3 months of buffer. So if when we have placed the order quarterly, if there is any issue for that order to come, we still have some level of stock remaining at the central warehouse to distribute to the regional warehouses. Okay. So various options can be correct, but again, it depends on the data which is currently present with us. After looking at all this, then we also look at capacity of the warehouse. If the capacity of the warehouse is not sufficient, then more warehouses should be there, and it is a very common practice. So, for example, in Ethiopia, the central warehouse consists of actually three warehouses, and all three warehouses are actually located in different places of Addis Ababa. Okay, and the reason being, so from different locations they dispatch products to different regions. Okay, so that's how they function, because for them a single warehouse was not able to keep all the products because of limited capacity, so they constructed two more. Okay, but both they constructed in different places so that it becomes easier for them to dispatch to different regions. Okay, so that's another way of looking at it. Okay, so that's a lot of information for this. Now the next question is, uh, how will order quantities be determined? Now that's a simple one. Okay, so I think uh, anyone can take a crack. It's a simple question. How will order quantities be determined? Yeah, I think it's a very simple question. So anyone, please can submit a response either on chat or you can also speak.
Okay, I'll start again. I think this is a straightforward forecasting issue whereby we will use a forecasting method basing on available data, whether it's a consumption data or service data or surveillance data.
Okay. Yeah, that's a simple one. Like Lou also saying, and actually also saying based on demand, and rightly said, sense check at the national level. Average monthly consumption can also be used. So all this is simply to say based on demand. Okay, which Exilia, I think it was Exilia, right? Exilia said in one word, demand. So based on demand, order quantities should be determined and orders must be placed. Now, the reason why we have put up this question is because when you do your annual quantification, you do your forecast on an annual, you know, annual cycle, your data may be a bit broad, and like we have seen and we have learned in the course that over a period of time, data may change. So every time each region must be looking at that annual forecast and supply plan data and making adjustments based on actual demand. So the final order quantity that the CLU is putting in their purchase orders to the suppliers may not always be based on the annual quantification or annual planning. That planning may be adjusted once actual consumption data starts to come, to the RLUs and then to the CL. Okay, or services data or demographic data, whatever. Whenever the data changes, the order quantity must also change based on that. Okay. Now, again, a simple one: who will pay the suppliers and how? It's again a very simple question. I think some of it we covered initially when you said CLU should pay the suppliers. This was agreed, but how? So that's the question. How will CLU pay to the suppliers? Because CLU does not have any jurisdiction on funds. Okay, still waiting for a response. Okay, in the meantime, maybe we can go to the next one. What procurement method should be used? Actually, they're saying according to the terms of the contract. Uh, no, that's okay. That will be. The question is more about accessing the funds, actually. So how will CLU access various funds and then pay the supplier? Also, how will CLU collect funds from RLU? What logic? And then what procurement method should be used by the CLU? Method being competitive bidding, open, closed, international, national. So what method should they be using? These are very simple questions now. The initial few questions were a difficult one because they were a bit broad. But now we are asking very simple questions. Again, these questions are those strategic choices which we discussed initially in the theoretical part. So please write in the chat if you are using chat. Last question being, what service should the freight forwarder be asked to provide? Like we read in the case that freight forwarders are used between the seaport and the regional warehouse. Now, in this case, if you are setting up a CLU, so how would that change the service provision of the freight forwarder? So, three questions. First one, how will CLU pay the suppliers? Where will they access the funds? In what logic? Second, what procurement method? And third, service provision for the freight forwarder. How will it change based on the new system? Okay. So I'm waiting for chat, responses on chat, or if anyone wants to speak, please go ahead.
I will speak to the Incoterms. What service should be the freight forwarder be asked to provide? I think we should use CPT, which is carriage paid to. No, CIP, carriage,
Yeah, that's
carriage and insurance paid to.
Yes. Yes.
Yeah, but we should include insurance. Yes.
Okay. And any idea of uh, the the location from freight forwarder picking the products to where the freight forwarder dropping the products?
The CIP should be to the CLU warehouse, which is probably the city where the CLU is located.
Yeah. Okay. That's fine. Any other responses to the previous questions or even this one? We're almost at the end of the group discussion. After this, I will not ask you to speak. All right on the chat. So we are almost done. And then we will send this slide to everyone so that you can make adjustments to it and use it for the assignment. Yes, Mujandira.
Or the procurement method, I propose that the CLU should use the ITB, but the ITB should establish a long-term agreement with the supplier.
Okay, that's good. Now, Muzaliba, when you say ITB doesn't necessarily mean whether it is national or international. ITB means invitation to bid. Okay, so I believe you are saying it should be an international ITB, if I understood you correctly.
The ITB I'm referring to here is the international tender.
Yeah, international ITB. Yeah. So just so you know, ITB means invitation to bid. It does not actually mean, as a term itself, that it is international or national. So you have to specify that it has to be international ITG. Okay. Otherwise, it can be again, it is open to interpretation. Then, like I was saying, if we don't write our procurement strategy properly, then it creates space and makes it open for interpretation whichever way possible. Okay. Vincent, not sure what exactly your full name is saying should use FOB for sea transport. Now, you can use FOP for sea transport, uh, but who are you giving that FOB Incoterm to? Are you giving it to the freight forwarder or giving it to the manufacturer? Because again, the seaport is not in Fictivia. The seaport is in the neighboring country. So even if you are using FOB for sea transport, you need to uh, specify to whom you are giving that Incoterm. Are you giving it to the freight forwarder or are you giving it to the manufacturer? That is another question.
So yeah, let me come in and explain my Incoterm. That's why I used the CIP instead of CIF.
Yeah.
Because this country is landlocked. So I'm giving this instruction to the manufacturer so that when they subcontract the freight forwarder, they do it throughout via the sea up to the port of the other country, and then also through land transportation up to Fictivia city where the CLU warehouse is located.
Yeah, that's correct. So Vincent from chat, that is the logic that is required. So even if you are using FOB, so the logic has to be correct from where to where and to whom. So Muzondiva, actually, I was responding to Vincent, who is written on the chat, not you, but you have explained it beautifully. So that is the logic that we have to use here, depending on the condition at hand. Okay. This question has not been answered, the how question. So if you ask me, the recommendation here is that each RLU earmarks the funds based on their own demand, based on the order quantity for each RLU, and those funds are then set up in a central pool which the CLU can access to pay the suppliers. Okay, so that is what the how meant here. But there can be other ways of looking at it. Anesu is saying there can be focused working groups for special disease areas of interest that can be funded by RLUs and NGOs. Yes, and they pay through the CLU in all other conventional diseases areas done by the CLU specifically. Yes, that's correct, Anesu. Like I said, there are multiple permutation and combination in this case because it may depend from product category to category. It may also depend if there is a donor who's paying the CLU to purchase products. It may also uh, be some cases where a donor is paying regional health directorate for certain diseases, which eventually is routed through the CLU. So there can be multiple combinations here. But again, the idea is a recommendation is that all the regions together create a central pool, and that pool is then being used by the CLU to for any transaction with suppliers. Okay, and that's a very and that pool has to be monitored by multiple entities. Okay. Yes, that's correct, Tinashe. So we have more or less written the responses of all the questions, and we are also now going beyond the allocated time. So what I would now do is stop this share. Whatever that we have done so far is okay, and then you can by yourself add more information into the slides before you submit it as part of the assignment. but I would request Priyanka to launch the feedback poll. And in the meantime, if anyone has any questions about this group assignment, about a certain question which was being asked, or about this entire session, please, I would love to answer them. Or else, after the poll, we will end this session. Okay, so thank you so much. We have very positive response, about 90% very good to excellent, and then a small percentage of people who don't like me, who don't like what I say. So maybe I'll have to improve a bit more. But yeah, thank you so much for listening to me yet again. We will try to bring another speaker in the next couple of sessions which are left, so that you don't have to listen to me all the time. But I would really, really appreciate if you ask more questions, you send more comments in, because that is the actual objective of these sessions, to actually be able to hear each other, converse, have a dialogue, and that is uh, how this course has been designed. I mean, if I give you an example of Nigerian class, the amount of questions that they ask in these sessions, every time we are delayed, we almost every time we go beyond the allocated time, but everyone stay behind because they want to ask more questions, they want to interact with one another, and that's the beauty of it. And we don't mind staying uh, beyond the time that is allocated. It's totally up to the participant, but it is only permitted if there is a very meaningful dialogue going on. Okay, so I would really appreciate next time we meet, you are a bit more open. I know it's a bit difficult online, but no one is judging you. No one, there are no wrong answers here. We are here to learn, and we will learn more if we interact more. And that is the entire essence of the hive. So with that, if there are no other questions, comments, clarification, Priyanka, please end the session in about next 20 seconds. If there are any questions come up, then I will respond, or else you can end the session. So thank you so much for listening to me yet again. We will share the slides and the recording with you shortly. And then I'll see you on the Hive and next week on the call as well. Thank you so much. Have a great rest of the day and the weekend as well. Thank you.